cut these corners, try to take the easy way. I kept on falling short of something. I could have gave up then, but then again I couldn't have, 'cause I've traveled all this way for something. I take it in, but don't look down. 'Cause I'm on top of the world, hey. I'm on top of the world, hey. Been waiting on this for a while now. Paying my dues to the dirt. I've been waiting to smile, hey. Been holding it for a while, hey. Take you with me if I can. Been dreaming of this since a child. I'm on top of the world. 'Cause I'm on top of the world, hey. I'm on top of the world, hey. Waiting on this for a while now. Paying my dues to the dirt. I've been waiting to smile, hey. Been holding it for a while, hey. Take you with me if I can. Been dreaming of this since a child. And I know it's hard when you're falling down, and it's a long way up when you make the ground. But get up now, get up now. And I know it's hard when you're falling down, and it's a long way up when you make the ground. But get up now, get up now. 'Cause I'm on top of the world, hey. I'm on top of the world, hey. Waiting on this for a while now. Paying my dues to the earth. I've been waiting this long, hey. Hold me there for a while, hey. Take you with me if I can. Dreaming of this behind. I'm on top of the world. I used to think maybe you love me. Now, baby, I'm sure. And I just can't wait till the day when you knock on my door. Now, every time I go for the mailbox, I gotta hold myself down. 'Cause I just can't wait till you write me you're coming around. Now I'm walking on sunshine. Whoa, I'm walking on sunshine. Whoa, I'm walking on sunshine. Whoa, and it's starting to feel good. Hey, all right now, and it's starting to feel good. Hey, yeah. I used to think maybe you love me. Now I know that it's true. And I don't wanna spend my whole life just waiting for you. Now I don't want you back for the weekend, not back for a day. And no. I said, baby, I just want you back, and I want you to stay. Oh yeah, now I'm walking on sunshine. Whoa,
Welcome to the American Heart Association's Empowered to Serve Business Accelerator. Thank you so much for joining us today. This is a special event for all of us at the American Heart Association, as 2021 marks the 5th year of the Empowered to Serve Business Accelerator initiative. And since we started, the American Heart Association has run 4 national and 5 local accelerators around the country. Tonight is our first Empowered to Serve Business Accelerator in Oregon and Southwest Washington, and it's our first in the Western States region. We want to extend a huge thank you to the Marie Lampron Foundation, which through a generous grant made it possible to bring this program to us tonight. They too saw the need in the community and the potential of local women innovators who are often underrepresented and underfunded by investors. The American Heart Association is working to increase health equity by helping break down barriers to healthy living, but we can't do it alone. One way we're addressing this challenge is by calling on social entrepreneurs who are already working in our communities to close gaps in health equity. Which brings us to this evening. Today, we are celebrating 6 incredible women who make up our inaugural class of local entrepreneurs working to give more people an equitable chance at living healthy lives. For the past 4 weeks, they've participated in an MBA-style training program to prepare for tonight's event. In a few minutes, we'll all get to hear how their business models tackle social influencers of health in our communities. We hope you're as inspired by these innovators as we are. So let's get started. Our MC is a local journalist with KGW News, Christine Pitawanich. Christine has been with KGW since 2015, and many of you probably recognize her face and voice from her recent and notable coverage of the COVID-19 pandemic. We're thrilled to have her with us tonight, so please welcome Christine.
Hello, and thank you so much for the introduction, Kathy. Wow, it is such an honor to be here with you all this evening for this important, fun, amazing event. And as Kathy mentioned, we are so very thrilled to empower these 6 local women to create lasting change in our community. You'll have the opportunity to hear directly from them about their projects very soon here, but first, we have a special guest to discuss a topic you may or may not have been aware of or heard of called social determinants of health, and why the American Heart Association chose to put this call to action out for women social entrepreneurs. Katrina McGee is the American Heart Association's National Executive Vice President of Marketing and Communication. Katrina, thank you so much for joining me this evening. And for those of us who may not live and breathe health equity issues, can you just talk a little bit about what social determinants of health is?
Well, thank you, Christine. I'm delighted to be with you this evening. You know, social determinants are really the economic and social conditions that influence a person's health.
Okay, and so then what causes that social determinants of health, and really what are the big drivers when it comes to health disparities?
Well, you know, social determinants are really influenced by how much money, power, and resources are distributed in local communities. And honestly, the greatest driver of health disparities, meaning the health outcomes of one community versus another, are really the social determinants that limit access to affordable housing, healthy food, and quality health care.
Okay, so it's like a trickle down, basically. You know, why is the American Heart Association, why did it say, you know what, we've got to be involved in this work?
Yeah, it's because we believe every person has the right to live a long and healthy life. You know, that's what our mission is, and that's what we're about. And the thing is, we can't just talk about it, we got to walk it out. And so we really do work to stand with under-resourced communities that often face higher risks for heart disease and stroke and other chronic conditions.
Absolutely. And for this specific local accelerator, why was the focus on women?
Well, you know, nationally, AHA sets our mission priorities. And in Oregon and Southwest Washington, we're really focused on nutrition security, hypertension, and women's health. And of course, we have to have women-led innovations to support, you know, the overall health outcomes of women. But here's the deal, you know, women innovators are often underrepresented and underfunded by VCs. In fact, the Portland team told me that over $400 million had been invested into Portland area entrepreneurs and companies, but only 1.6% of the funds from VCs were directed toward women. And I was like, what? Oh my God, it's an opportunity. It's an opportunity to help us stand with women who are offering innovative solutions to the issues that we care about the most.
Yeah, and we've got some women on tonight that mind blown. They've got some amazing ideas. But Katrina, thank you so much for taking the time to come on with us. Tell us a little about, you know, social determinants of health and why it's so important that AHA decided to get in on this. So appreciate your time.
Absolutely. I can't wait to hear all the great presentations.
Me too. Thanks, Katrina. So, it is clear that we all have a role to play in building a world where everyone has the same opportunity for good health, regardless of which zip code they may live in. Voters, neighbors, parents, leaders, elected officials, we all need to listen to communities, work together, to think outside the box, to think differently so that we can come up with a real and lasting solution. And that is what this event is really all about. Tonight, our finalists are going to share how their business solutions are doing just that. Each candidate has 5 minutes to tell us who they are, present their business concept, and how their idea is going to promote health equity. And at the end of the evening, we're going to be announcing the top 2 grant recipients and a fan favorite that many of you have already been casting your votes for throughout the past 2 weeks. So thanks for doing that. We're awarding a total of $120,000 tonight. Yes, $120,000. That is so exciting. We have a lot of ground to cover, so let's get started by meeting our judges. We have 3 amazing judges joining us this evening: Sam Yamoa, Dr. Stephen Noble, and Sally Bainey. We're going to hear from all of our judges, but Sam, we're going to be starting with you. First, though, a quick introduction to Sam. He is a Chief Strategy and Innovation Officer for Regence Blue Cross Blue Shield. Sam drives Regence's strategic framework to serve customers with innovative healthcare solutions. With deep experience in business building and health insurance systems and technology, he has a history, really, of bringing teams together to solve some of healthcare's toughest challenges. Sam has also previously served as a judge for an AHA Accelerator event, that one in Minnesota. So Sam, I see you on screen there. It is so great to have you tonight. Can you tell us a little bit about why you decided to be a judge again?
Thanks so much, Christine. It's a pleasure to be with you and all of who are joining virtually. The AHA is a very storied organization delivering so much impact in our communities, both in Minnesota and now being in Portland. I think this is an important accelerator program because I believe prioritizing innovation, it's one of the key unlocks we have to addressing most of our challenging problems. It allows social entrepreneurs to take risks. It allows people to be equipped to, address challenges that are ahead of us. So what better way to be a part of something that continues to deliver more for our communities that we live in? So again, very excited to be here and be a part of the American Heart Association, all the work that you deliver to support communities and families.
We're excited to have you here too. Thank you so much, Sam. Great to meet you. Thanks for giving your time tonight. Next up, we have Dr. Stephen Noble. Dr. Noble is a board-certified cardiothoracic surgeon. He's also a decorated Navy veteran, entrepreneur, healthcare executive, associate producer, speaker, and best-selling author of the children's book, The Heart of a Hero, the Dr. Daniel Hale Williams story. Whoa, what a list. Dr. Noble is passionate about addressing healthcare disparities that communities of color face. So glad you could join us here, Dr. Noble. I understand that you were actually involved with a company that won a past Empowered to Serve Accelerator grant, right?
Yes, indeed, Christine, and thank you. It's a pleasure to be here with everyone this evening. And it truly is, as a Portland, Oregon native, it truly does my heart well to participate in this event, working with these amazing women, seeing their stories. And I can attest firsthand as to the impact that these funds can make in the startup cycle of a young healthcare organization. And so to participate as a judge has truly been an impactful and enriching experience, both personally and professionally. So thank you all for all the work that you have done.
Okay, well, thank you so much for being here, dedicating some time out of your busy, jam-packed schedule tonight. Appreciate it. And last but absolutely not least is Sally Bainey, co-founder and trustee of the Marie Lamfrom Charitable Foundation. Sally's personality, passions, and life path have largely been shaped by 2 very important women in her life, her mother, Gert Boyle, and maternal grandmother, Marie Lamfrom. Their influence and example forged Sally's work ethic and deep connection to her community. In fact, in the 80s and 90s, Bainey played a key role at Columbia Sportswear, overseeing the retail outlet store side of the business. Sally cherishes the opportunity that the Marie Lamfrom Charitable Foundation gives her to empower the people and projects that she knows her mother and grandmother would want to see flourish. What a legacy, Sally. We are so thrilled to have you here. And wow, you are a part of a line of women who have made such an impact on our community. Why are you so passionate about all of this work?
Well, I am so happy to be here tonight, and thank you so much for giving me and Marie Lamb Charitable Foundation and all of our staff the opportunity to see these 6 amazing candidates. When I think about what I'm most excited about is not only my grandmother was Marie Lampham, and they immigrated from Germany in 1938 to Portland, Oregon. So Portland, Oregon gave them and my grandmother and my mom's family a chance. And this gives 6 people a chance to express what's in their mind, the businesses that they've had, excuse me, have had, going in their mind, and they've got a chance now to make it a real live thing. And so that's basically the reason why we are just so excited to be involved tonight.
And the Marie Lampham Charitable Foundation, I mean, I know that, you have a personal driver as to why you think this work is so important, giving an opportunity, but why did the foundation decide, you know what, we're going to get in on this?
Well, we work really hard here looking for things that, like you said, people who think outside of the box. So this was something that really attracted us. It was like, this is really an awesome opportunity for people. We'd never heard of it before. And we all got together, the whole staff, and said, yeah, let's go for this and see what happens. So we're very excited and can't wait to hear who comes out on top, and all the people that will watch and see these amazing ideas. And, Marie Lampham Charitable Foundation is just so happy to continue the legacy of my grandmother, Marie, and my mom, Gert Boyle.
Well, thank you so much, Sally, for again taking the time out of your busy night, being here to support this important work. We appreciate your time. And of course, thank you to our wonderful judges, all of whom are joining us this evening. But before tonight's program, our judges actually had the opportunity to meet up with the candidates, learn more about them, their business, and how they will create sustainable and meaningful change. And now it's time to hear the candidates' business stories. And without further ado, let's go ahead and start the show. First up, we're going to be hearing from Tylea Johnson Allen. Tylea leads the team at Hands That Help. It's located in Portland, Oregon. She is a substance abuse professional and a community advocate for the African American and BIPOC community. Hands That Help works in the community, helping its clients connect to various resources that might be available. So great. Can't wait to hear more about what you do. Take it away, Tylea.
Thank you. So I'll jump right in. I grew up in the 1980s. I was born in the Pacific Northwest. I was born to a mother that was 12 years old. So I am the oldest grandchild and the youngest of my grandmother's children, if you know what I mean. I can remember us moving various times, and I remember specifically one place where we lived, and that was 35th and Killingsworth in Portland, Oregon. And then in the late 1980s, mid to 1980s, yes, it was considered the urban area, but it was defined by many different characteristics, and some of those characteristics included poverty, it included low income, it included gang violence, it included drug infestations with crack cocaine. So just to say that the area was underserved, under-resourced, right? Geographically doomed, okay? Just growing up, going through my own trials and tribulations, I found myself in a struggle with an addiction, okay? And mental health conditions, and just being in a very, very, very dark place. And I'm saying this because what I found on my journey, and after years of sobriety, is that I found a calling, and I no longer wanted to see others suffer in that place of darkness the way I did. Okay, and my folks in church would say that I got my marching orders, right? And so becoming a substance abuse counselor really saved my life. Not only did I have a team that cared about my holistic well-being, but they also just gave me the encouragement and empowerment to continue on and to reach back to others. Now, those in the AA program know about, you got to reach out to the next person struggling. Our team, I lead a team at Hands That Help, and we have an understanding that we want to identify the urgency that our clients are going through as soon as they come through our doors. And 9 times out of 10, the clients that we help, they're in a place of despair, a place of their back is against the wall. They don't know where to go or what to do. Okay, so I'll give you an example. A client would come in and lights are off. The food's going bad in the refrigerator. They don't have any money. Okay, so our first step is to simply not ask, how can we help? Right? Because the days of being kind and having empathy is just not enough anymore. Right? Here at Hands That Help, what we want to do is ask them, get to those questions to get to the root of things. What's going on? Right? And we bring our skills, we use our cultural competency to kind of have those conversations and have that open dialogue where our patients, or excuse me, where our clients feel safe and they feel that they're being heard. They feel like their voice matters. Okay. And so after we kind of get to the root of what's going on with our clients, that will give us a chance to kind of explore our options. Right? We work as a team, so we continue to, if we don't have the resources, we never leave no one out. We never turn anyone away. We definitely go into and reach out to other resources and find what's secure, what's going on, what do we need to do to help them as a team. Our team proposes a 5-year commitment plan for our clients, and what that 5-year commitment plan looks like would be us addressing their stability, the urgent need first, right? Going then on to mental health assessments, substance abuse assessments, and then also finding job placements, recommendations as necessary. Here's the thing. Many times, those around me didn't think that I would make it. And the reason why I did is because I had a team who cared about my well-being in a holistic form, right? It wasn't just, let's put a Band-Aid on the cracked egg. We have to treat everything. That's the spiritual well-being, the mental well-being, and as well as the physical well-being. Okay, my name is Tylea, again, with Hands That Help, and I thank you all for your time.
Wow, Tylea, thank you so much for your vulnerability and telling us about what you call a calling. Our next innovator is Candace Smith with Caregiven. It's a Portland-based company that has created a mobile app and web platform that empowers family caregivers as they provide support for loved ones following an injury, illness, or as they age. Candace, tell us a little more about this awesome idea.
There was a moment, I remember it clearly when looking at my dad, that I realized that he was the sickest I'd ever seen him, and yet he was the healthiest he would ever be. That hopeless feeling wasn't where my time as a caregiver began. It was, however, one of the significant realizations that led to what has become my life's work, Caregiven. Every day in households throughout the world, there are daughters and sons, nieces, neighbors, friends, and however you want to define family, rising to the occasion and giving care to someone they love following an accident, an illness, an injury, a diagnosis, or even throughout the aging journey. Here in the US, there are 53 million family caregivers, and like me, they find caregiving overwhelmingly hard, more difficult than it needs to be. As a result, those we care for are impacted. And seeing that means we caregivers try to do even more, affecting our own physical, financial, and emotional well-being. Family caregivers who aren't overwhelmed help achieve incredible health outcomes for their loved ones. Trips to the emergency room decrease by 1/3. Admission to the hospital drops by 25%. Hospital stays are shorter, and readmission is significantly lower when a family member is involved. I didn't know any of this when I was caring for my dad. While I was worried that I was getting in the way of the professionals, I was also hurt and a little bit angry that none of them were giving me what I needed to be a better partner to them and to be the best daughter to my dying dad. That is a pain Caregiving abates. Our mobile app and web platform empowers users to know what they need to know when they need to know it, helping them to understand why it, whether that's medical, legal, financial, or emotional in nature, why it is important, and then giving them the guidance and encouragement to take each step and ask the hard questions. One of the hardest questions I have ever asked was, Dad, do you want to live longer? Words that I was compelled to speak as I saw my dad agreeing to a new treatment plan that would disrupt his days and make him sicker, but he could expect to live 3 months longer. Medicare has reported they spend over $30 billion annually on individuals in the last year of their lives, and as much as 80% of that is either unwanted or medically unnecessary. The right question asked by the right person at the right time can change this. My dad's answer was, of course, no. And while I will be forever grateful that I was brave enough to ask, of course, I'd give anything to have had those 3 months with him. Caregiving normalizes experiences like mine. We reduce caregiver stress and overwhelm. We empower more confident caregivers, which results in those better health outcomes that I mentioned earlier. After launching in April, we have over 400 users on our app and are collecting incredible information from them on how to make the caregiver and the caregiving experience even better, which is what we will use this grant funding for. Caregiving delivers a culturally safe, personalized experience that speaks to individuals and empowers them to access the care that they are entitled to. This grant will allow us to better deliver on that promise by incorporating content specific to an illness, faith, culture, recovery process, or country to empower the right questions that lead to the right care decisions and ultimately help the user to be a better caregiver, something every member of the caregiving team wanted for themselves. My technical co-founder lost her mom while leading engineering at one of the fastest growing software analytics companies in North America. Our chief revenue officer also lost his mom while helping a prominent insurer double in size in 5 years. Our marketing leader lost her sister, her mother, and her father while launching products like the Heart Start and WebMD. Together, we are building the resources we all wish we had. We are using the hardest time of our lives to help others as they go through the hardest time of theirs, knowing that the outcome isn't in the control of the caregiver, but their journey and that of their loved ones most definitely are. So I'm truly grateful to have been able to participate in the Empowered to Serve program and for the opportunity to share my story, caregiving story. During the program, you asked me to dig deeply and identify what I most fear, and it's that my dad's death had no meaning. While this fear drives me, it also keeps my dad close, has given me my life's purpose, and is manifested in caregiving, which is helping family caregivers. Thank you.
Candace, thank you so much for telling us about your father and sharing your story. Next, we'll hear from Kelly Gonzalez with Natives for Community Engagement and Equity, or NCEE. Kelly is a citizen of the Cherokee Nation of Oklahoma and an advocate for the Portland area and Southwest Washington Indigenous communities. NCEE is it's a dedicated team of Indigenous advocates that work for justice and equity in the community and public health policy. It is such important work. Tell us a little bit more about it, Kelly.
Thank you. Good evening. I'm happy to be here and I appreciate this opportunity offered by the American Heart Association to share my vision with you. A vision I have dedicated my entire life to, as it was inspired into me by the dreams of my ancestors. First, I want to give an acknowledgement to the Indigenous lands and the Indigenous peoples of these lands and where I do my work, known today as Portland, Oregon. Portland is the traditional homelands of the Chinook, Willamette, Confederated Tribes of the Grand Ronde, and other tribes that lived and fished, had ceremony and commerce along the sacred waters of the Columbia River. As a Cherokee, I am a guest here, and regardless of where I call home, I am always responsible to care for all my relations. So hello, Osio. My name is Kelly Gonzalez. I am a citizen of the Cherokee Nation, mother to Rin, Jubilee, and Caleb Starr. I am sister, aunt, friend, and advocate to my people who love me and claim me as kin. I am a legacy as I descend from a legacy of miracle survivors of genocide due to colonization and its lasting impacts on my people. I come to this space as a first-gen student who recently earned tenure and promotion to as associate professor. I am one of only a handful of Native scholars to earn this goal. When I graduated in 2010, I was the only Native in the country to earn a PhD in public health. Today, the workforce disparities still remain. As a PhD trained and NIH-funded researcher, my work has helped to build a body of science into the adverse impacts of racism and colonialism within healthcare systems, healthcare engagement, public health research and data, and with regard to diabetes and hypertension. While the evidence into these harmful impacts is well documented, they remain marginalized and non-existent within the public health curriculum and systems. These gaps produce a public health workforce and system and solutions that are not prepared to consider and or meet the needs of Indigenous peoples. And despite its good intentions, a public health workforce and system unable to name racism and genocide as determinants of health make Indigenous equity inconceivable. These logics are also evidenced and perpetuated in the tools of public health, including research and policies that further entrench the status quo. The COVID-19 pandemic revealed what has already been known among Indigenous communities, that white dominant institutions rooted in colonial and racist logics produce tools of inequity that perpetuate their genocidal complicity of Indigenous people and curtails life-affirming futures. These logics stymie any capacity for equity. As a team of Native scholars, researchers, advocates, and leaders, the Natives for Community Engagement and Equity is leading the way to right these injustices and address these system-level gaps. We mobilize in this worthy and ambitious vision by cultivating socially just public health institutions. We do this by preparing the leaders of today and tomorrow using our Healing Justice curriculum, transforming tools of public health, including research, data, engagement, and policies, and nurturing a community-based practice that's ready and willing to challenge, dismantle, and heal these oppressive roots of public health. And while there is motivation for anti-racist initiatives, many of them start at slavery and erase an entire history and people. And without naming colonialism, those anti-racist initiatives are effectively racist. So it's time to change this within the systems of public health. And as a collective of Native people, we're ready to lead the way. In closing, my name is Kelly Gonzalez. I am a proud Cherokee woman, and I am a founder of NCEE. Today is the time for action to move beyond the performative words of justice. I invite you to be a good relative and support us in this work to address these gaps within public health, to create the conditions needed to make Indigenous equity conceivable and possible. Funding from the American Heart Association will help advance this vision in the development and evaluation of our Healing Justice curriculum and tools, and help us to disseminate the needs through a strategic media campaign and broader reach and partnership building. Collectively, this is the right next step for justice because it is life affirming and life generative. And I sincerely hope you think so too. Wado, thank you.
Kelly, thank you so much for your valuable insight into health disparities involving Indigenous communities, so important for so many of us to hear. You know what, we are just halfway through our candidate stories and already I am so impressed, so inspired. This is such a fierce competition. I am very excited to meet the next three candidates. Maya Page with the Carry app is up next. Maya is a leader in human-centered design, always thinking about how experiences can be made better for people. The Carrie app started somewhere between the intensely hard yet love-filled path of having her 3 kids, somewhere along there. The Carrie app is based in Portland. It offers movement and meditation for pregnant people and new parents. Maya, such a cool idea.
Thank you. Carrie is a movement and meditation app for pregnant people and new parents. And our story is both professional and personal. There I was, 9 months pregnant with my 3rd, just wrecked by whole body anxiety, like nothing I had ever experienced before, keeping me awake at night. And I needed sleep. I needed relief before she arrived. I wasn't alone. Half of all pregnant people experience anxiety. And that number is now 80% amidst these pandemic times. Add in the terrible effects of systemic racism, increasing maternal morbidity for Black and Native women, as well as the fact that 45% of all pregnancies in the United States are unintended. And that makes for a whole lot of complicated, difficult mindsets for the 4 million Americans on this journey each year. What helped me? Well, moving my body during the day with walks and yoga, and at night, listening to audio meditations. Okay, and this one song on repeat too. But by moving my body, I was one of the few. Only 10 to 20% exercise during pregnancy, despite evidence showing that it improves maternal and baby health outcomes. Pregnant people everywhere need simple, proven, powerful tools like movement and meditation to carry them through pregnancy, birth, and beyond. The good news is that anyone can move their body in simple yoga shapes, and anyone can breathe with intention if we show them how. And with the Carrie app, that's right what we're gonna do. We have movement meditation sessions organized by trimester, including the 4th postpartum, or by body ache, like upper back and shoulders, or need, like making space or taking a pause. Knowledge articles too, fresh content updating monthly. We keep it all short because we know you don't have time. And throughout, we hear different accents and we show various bellies, bodies, and babies matching multiple families and mindsets. We're real, straightforward, and optimistic. This is Planet Parent and not an airbrushed projection. We know. My co-founder, Heather, is an incredible doula, teacher of doulas, childbirth educator, physical therapist, lactation counselor, parent. I could go on. And her expertise matched perfectly with mine in experience design, mobile apps, and innovation from Stanford to IDEO, Adidas, and Target. I asked my 2 favorite app engineers, Alan and Andy from the Adidas innovation team, to join, and we started researching, prototyping, bootstrapping, and thus Carrie was born. We're quietly live on App Store, and we have paying users with 0 marketing and 0 promotion. It's not a fluke. People are looking for this exact type of app. And with feedback like Meg's, writing me on the way to the hospital for an induction, writing, the early labor meditation helped calm some of the anticipatory anxiety she was feeling. Man, I know we're on the right track. Today, we're laser focused on all 4 trimesters of pregnancy. Tomorrow, we're gonna carry them right through to early parenting, having earned their trust right from the beginning, offering those same mighty tools, breath, movement, and knowledge for early parents. Your physical and mental needs persist as your babies grow into toddlers, little kids, big kids, and beyond. We also know from research that healthy parents drive healthy behaviors in their children, and what could be more important than that? I need an app like this right now for my crew. I've got 3 kids under the age of 7. I work, and I also am parenting my own disabled parents. I need all the help I could get. Winning this grant would be a glorious bang to get me faster out of the starting blocks. I would use the money in 3 chunks. 1, to record new audios and videos with incredible Black, Native, and queer teachers that I've been in conversations with. 2, to build new app features like push notifications and daily coaching. And 3, to get the word out with smart usage of ads and referrals. We can do this, and we need to. Research confirms these tools alleviate pain, stress, depression, and even improve birth outcomes. Our vision for Carrie is less fear and more confidence for every pregnancy and parency in the world. And we're here to raise the well-being of all parents.
Wow, Maya, what a cool idea. And I think all of us, that reminded us, it's okay, just breathe a little. So thank you for that. Now, please welcome our 5th candidate, Marie-Ève Monette, with Creating Puentes. Marie-Ève's language access consulting business is located in Portland. Through Creating Puentes, she collaborates with foundations, nonprofits, and non-English native speaking communities to design and implement language access plans so that everyone, no matter what language they speak, can access and contribute to shaping services usually offered only in English. Marie-Ève, the screen is yours.
Thank you. Creating Puentes is a mix of English and Spanish that means creating bridges. There are many different ways of building bridges, and I invite you to imagine one of my sources of inspiration to do just that. Imagine arriving at the edge of a ravine that is 100 and hundreds of meters deep. There is a suspended rope bridge, and it is the only way that you can walk across. Despite your trepidation and your fear, perhaps, it is an extremely strong bridge. There are 4 communities on both sides of the ravine that come together every single year to build this bridge. They use bridge building techniques that have been tested and in existence for centuries. They come together and use local resources, and they meet every single year to make sure that they renew the bridge and keep it strong. Having worked alongside Peruvian communities for over a decade now, I started building Creating Puentes inspired by these communities who come together annually to build these bridges so that they can connect. Creating Puentes connects communities and empowers them to build strong communication bridges based on their collective knowledge and experience. Looking at our community here in Portland, it's clear that Portland Metro cares about its people. There are thousands of organizations, including nonprofits, mutual aid groups, et cetera, that offer services to different communities. That's one side of the ravine that we have here. On the other side of the ravine, we have 20% of the Portland residents who don't speak English at home. At the beginning of the pandemic, the ravine, which still exists today, was language. Information about COVID-19 and its related impacts, such as the increased need for food assistance, wasn't being communicated across the ravine. When translations were made into Spanish, Russian, Somali, and other languages, they were arriving late because of the rapid evolving nature of the pandemic. What Creating Puentes does is work with communities from both sides of this ravine, of this language divide, asks them to build their knowledge and expertise to build that bridge so that they can connect, so that organizations can offer their services, but also so that non-native English speakers can communicate about and also shape the services that they need. The project that I proposed to the American Heart Association is to collaborate with foundations, nonprofits, and other organizations alongside non-native English-speaking communities with a focus on food security. And the purpose of the project is to design and facilitate a series of workshops on language access planning. Receiving funding from the American Heart Association will support the design and facilitation of these workshops alongside community leaders from these non-native English-speaking communities in the Portland, Vancouver area. Workshops like this have an impact. When organizations like this have a language strategy in place, more non-native English speakers have access to healthy and culturally appropriate food. Working together on this strategy also means that beyond building the bridge that connects them, they will also be building a network of organizations and communities so that they can keep working together beyond the workshop on overcoming language barriers and building an increased access to food security in the Portland, Vancouver area. What about health impacts though? An important part of language access planning is measuring the impact that offering services to non-native English speakers in their languages can have. The workshops would therefore allow us to work with communities and organizations on outreach strategies so that they could find out the access to food and also health of non-native English speakers before, during, and after the plan was designed and implemented and language services were offered. As a result, measuring the health impact would be possible throughout. That is, of course, only the beginning. These workshops would be virtual, and so they can be scaled. I would start in the Portland, Vancouver area, but they could easily be expanded to be offered at the statewide level in Oregon and Washington. And after that, this language bridge model could be taken in any region or city where non-native English speakers live and where language access is really under-addressed. This project is really important to me. As a French Canadian, I grew up within a family whose members were only offered certain opportunities if they spoke English. As a result, being able to speak your language and access the same resources and opportunities is personal, not just professional. In terms of this project, friends, my partner and I have lived food insecurity and scarcity. We were lucky to not have to face that during the pandemic, but we've tried to donate, to collect food and redistribute it. And when the accelerator came up, it seemed like the perfect opportunity to start setting these workshops in motion. It's up to us to bridge the language gap. I hope the AHA gives me that opportunity. Thank you so much.
Marie-Ève, wow, thank you so much for talking about that. And I mean, really in a pandemic, so important to be able to disseminate information to various families who speak all sorts of different languages. So really love the work that you're doing. Finally, we have Durenda Schubert with Bridge Meadows. Durenda is a leader of Bridge Meadows in Oregon, a psychologist and a mom who wants all kids to know that they're loved and all generations to know that they belong. Bridge Meadows creates intergenerational communities for the special reason of ensuring children who experienced foster care live safe and abundant lives. Durenda, what important work. Tell us more about it.
Thank you. Welcome to Bridge Meadows. I am honored to be here. When I was a little girl, I had a sense that something was wrong with my mom. And when I turned 11, her mental health problems were raging. Every day, I worried that she was going to disappear or worse, commit suicide. These are some of the reasons that children end up in foster care. I did not end up in foster care because of my tight-knit Polish immigrant family scooping me up and my aunts and grandmas being my safety net. This was my path to become the executive director of Bridge Meadows and a psychologist. My grandmas, or bushas as we say in Polish, relished being my protectors. And let me tell you, nobody messed with busha. So I was so protected and so fortunate and so loved. This is the opposite experience for children in foster care. They have a family crisis and then they are whisked away by a caring case manager or police and then placed with unprepared relatives, which is what we have here at Bridge Meadows, or strangers. And compounding that trauma is being separated from the siblings because there's just not enough room. Bridge Meadows creates communities of intergenerational belonging for one very special purpose, and that purpose is to support children who've experienced foster care to live safe and abundant lives. Siblings are kept together, and everybody who lives here knows protect the children no matter what. Bridge Meadows communities are created from a trauma-informed, inclusive lens, and we incorporate mental health specialists in our communities to be right there, right when the problem happens. And this is free to all who live here. We do this to shrink the impact of trauma on the children's health and well-being. The CDC and Kaiser Permanente conducted a study about children who experienced adverse childhood experiences. Without amelioration, these children become very expensive adults in the healthcare system. But when we have protective factors involved, there is opportunity for healthy living. Some of those protective factors include safe and stable nurturing relationships in the family, access to safe housing and stable housing, food, school support, health services, and caring adults who serve as mentors outside of your family. Every single one of these protective factors and more exists here at Bridge Meadows. One of the ways to just share with you how Bridge Meadows works is to tell you a story. So one of our moms, a single mom, an aunt who adopted her niece and nephew, became really ill, and her middle schoolers needed support. So elders scooped right in, and they provided food for the kids. They made sure they were up for school, and they even helped with homework. 7th grader Andrew was a little worried about his book report, and so Carol, elder, sat with him right here on our patio and helped him do his book report. She even read the book and brought snacks because, no food, no, better outcomes. So he got an A. I know, of course he did. And so did Carol. I think she's proud of that A. And our children are resilient because they know all these people care about them and love them. The elders were so happy to help the family because they then were living with meaning and purpose. And research shows that when we live with meaning and purpose, it has a positive impact on our health. And while I'm talking about the elders for a minute, I just want to share with you that during COVID, not one elder contracted COVID because of the protection in this community. And now they're protecting the children until they're vaccinated. When we created Bridge Meadows initially, we got a lot of criticism from the real estate experts saying we cost too much, why are you putting mental health services in there? But we knew by building high quality housing and integrating mental health services, which is quite disruptive in the industry, that we were going to have better outcomes and save money in foster care, health, and the juvenile justice systems. I want to tell you that we are expanding Bridge Meadows to Redmond, Oregon, and we are so excited. And we're receiving national acknowledgement of what we're doing. The New York Times, the Washington Post, and we were in an anecdote documentary. That's the name of it. Right now is the time for Bridge Meadows to expand. I am committed, my whole heart. I was so blessed with the love and support of my grandmas, and now I want that for other children. Bridge Meadows is so powerful because it is one solution, one antidote for many social determinants of health. Right now, it is our turn to protect the children, because when we do that, we protect the generations. Thank you.
Durenda, that is such a cool idea. And thank you so much for sharing about how your childhood has influenced now your life's work. Amazing. Wow. I don't know about you guys, but I am just floored. This is such an impressive group. I definitely do not envy the judges for having to make a decision and decide between all these outstanding individuals and their innovative projects and ideas. Thank you all for giving of yourselves and sharing your stories. In just a moment, we're going to be awarding grants to 3 of tonight's finalists to help support their projects in the community. They're going to be making such a difference. Our first place recipient will receive $75,000. Our second place recipient, $30,000, and our fan favorite, who you all have been voting for, will receive $15,000. This amazing opportunity has been made possible by our sponsor, the Marie Lamfrom Charitable Foundation. So thank you, thank you, thank you for your commitment to changing the trajectory of health and well-being in Oregon, Southwest Washington, and beyond. These awards will allow 3 entrepreneurs to scale their businesses to create a healthier future for so many people. It's equally inspiring and super exciting. So with that, drum roll please, because I've received word that the scores have been tabulated and we now have our 3 grantees for the first ever Empowered to Serve Business Accelerator, Oregon and Southwest Washington. I'd now like to invite Leslie McCall, Executive Director of the American Heart Association of Oregon and Southwest Washington, on to announce our awards. Leslie, hands down, you got the best job tonight.
Hi, Christine. Thank you. Yes, I really did get the best job tonight. I feel very honored to be able to give out the awards this evening. So this moment feels like the end to the accelerator with it being the finale, but I know in my heart this is really just part of the journey. You know, we've had these 6 candidates that are amazing and they've gone through this training and they're going to continue on with these new skills that they've developed, with the bond that they've formed, which you can see in the chat box that they support each other. And 3 of them are going to continue on with funding to help, you know, continue their ideas and bring that to our community. So here we go. So fan favorite award, I'm so excited to share. There were 1,245 votes, and with 35% of the vote, our winner is Tylia Johnson Allen with Hands That Help. Hi, Tylia.
Can you hear me okay?
I can hear you.
Hi.
Congratulations.
Thank you so much. I am so happy and so honored. Thank you all for your votes and your support. I promise you, I could not have done this without you. Thank you to the American Heart Association for giving me this opportunity. It's amazing. Thank you very much.
We are so excited for you. I know we'll talk soon.
Okay.
Congratulations. We'll see
Thank
you a little later. Okay, we are going to move into our second place award, which is the grant of $30,000. And I am thrilled to share that tonight's winner is Candace Smith with Caregiving. Hi, Candace, congratulations.
Hi. Thank you so much. My team, congratulations to my team who got us this far. This has been a tremendous opportunity, and I'm so grateful to the foundation and to the American Heart Association for giving us the opportunity. Thank you.
Wonderful. Yes, congratulations. See you later. Okay, and here we are at the end of the awards. Our first place grant for $75,000 goes to Maya Page for charity.
Wow. Thank you. Thank you so much. I mean, wind in our sails. Thank you so much to the Marie Lamb from Foundation, to the American Heart Association, to Krista, our leader, to the incredible colleagues here and new friends. And we're really ignited by our vision, and thank you.
Absolutely. It's exciting to see you have this moment. So and we'll see you later, Maya, but congratulations.
Thank you so much.
Well, congratulations to all of our 6 candidates. It's been just an honor and a pleasure to have you in this program with us. Congratulations to our grant award winners. We are so excited to see the work that you do in the future in our community. I'm grateful for your ideas. So Christine, we did it.
I know, that was so exciting. I loved that. This is what it's all about, right? Innovation and really pushing our community forward and hoping to create lasting solutions. Thank you, Leslie.
Absolutely. Thank you.
And Dr. Noble, Sam, Sally, thank you for giving your time as judges this evening. I know we all so appreciate your leadership in our community. And 100% I echo Leslie in congratulating our grant recipients and of course all 6 of our candidates this year, because I said it like this is going to be the 3rd time I'm floored, because I just love all of these ideas. They're amazing. And the work that you're doing to increase health equity in our community is important and inspiring. We wish you all the best of luck as your businesses continue to grow. And you can find more information on the candidates, their businesses, their ideas at empoweredtoserve.org/Oregon. The link is also in the chat. We're also going to be including it in a follow-up email, so don't worry, you'll have it. I know you'll join me in congratulating our winners and candidates for their incredible work. I know the chat has just been popping off with so many congrats. We have witnessed such commitment and passion tonight, and it has been my pleasure to share it with you all. Thank you so much for joining us. We appreciate your time, and we hope that you have an absolutely wonderful evening.